Hello, everyone. Welcome to MS Confidential, a monthly webcast series consisting of candid conversations about navigating the day-to-day chaos that comes from living with multiple sclerosis. Tonight's discussion is centered on the relationships that patients establish with their healthcare providers and the importance of establishing a strong foundation of trust, which is critical to a successful patient-provider relationship. My name is Lisa Foote, and I am here to help with any questions you may want to ask our panelists. So please put them in the chat box, and we will try to get to as many as we can during the question and answer segment of the program. Another thing that is so great is that we have Dr. Moyez Jiwa, who will be joining us during the Q&A, and he is joining us from Australia. He is a family physician working in Australia and the author of the book, The Art of Doctoring. He's also the host of the Health Design podcast. And we wanted Moyez to join us this evening because he believes that doctors can help the healing process, even when, and most importantly, when it's not possible to find a cure. So I could say more, but I would really love Dr. Jiwa, if you would please say a few words about yourself.
Thank you very much. It's a great honor to be here on the show. I'm delighted to have been asked. You're right, it is a huge challenge, a technical challenge to make a diagnosis of MS, particularly the early phases of the illness. So it's a technical challenge, but more importantly, it's a communication challenge. It's a communication challenge because people really need to feel that they've been seen and heard. And that's really why I am particularly interested in this condition. It's really important that not just at the time of diagnosis, but throughout their journey, that patients feel that somebody is interested enough to give them the time and the space to say what's going on.
Thank you so much. And we'll see you during the Q&A. So right now, I'd like to introduce our regular group of panelists, and they can just wave hello as I introduce them. First, we have Dr. Annie Brewster, who is joining us from Boston. She's been living with relapsing remitting MS for 20 years. She founded the Health Story Collaborative, which is committed to keeping the patient voice alive in healthcare and harnessing the healing power of stories. Next, we have Kyle Cronick, who is coming to us from Asheville, North Carolina. Kyle has been living with progressive MS for 10 years, and he very openly and honestly shares his journey with MS in hopes of reaching others living with similar circumstances. You can see his vulnerability and his positivity in action on social media, and his Instagram handle is Gotta Keep Going, which is indicative of the way he chooses to live. Next, we have Jessica Ohler, who was diagnosed in 2012 with relapsing remitting MS. She's a conceptual artist and a scholar living in Davis, and she explores the history and relationships of landscapes and the body. And she recently expanded her practice to include playing the cello. And last but not least, we have Elizabeth Jameson. Elizabeth lives in the San Francisco Bay Area and is a former lawyer, healthcare advocate, and artist who has been living with MS for over 20 years. She now writes personal essays and speaks across the country, sharing her experiences about the universal human experience of living with illness and disability. So I'd like to say that for many of you know, MS is a progressive disease that keeps changing, and it can make it challenging for patients to adapt to the perpetually evolving effects of MS. There's not just the physical effects that MS carries, but also the effects of mental well-being, and ultimately the overall quality of life for the patient. All of our panelists, I know, have their own take on what it means to have this constantly evolving situation, and then also how the physician plays a role in this progression. So I'd like to know how they address it. So Elizabeth, I'd love to start with you. If you can tell me about the importance of establishing trust with your physician, and if there was a situation where it was either great in establishing trust or not so great.
I think establishing good communication with my neurologist is critical because I have MS. That's the specialty that I go to, though I have lots of other physicians and specialists, subspecialists. I think my neurologist, my key person, I really need to establish trust and faith in. And example of what I like about my physician, that when COVID happened, I just called him up and said, hey, it's COVID time and I'm having trouble breathing. Do you think we should do anything about it? Said, yeah, I got it. I'm gonna set you up with tests and orders for a ventilator, etc. So I didn't have to think that much about it. I just trust him implicitly. And I must say, I'm very grateful and lucky that I have such good health care. I really don't take it for granted. And I feel blessed.
Kyle, you had recently shared about a relationship that you have with a new physician. Can you tell us a little about that and trust?
Yeah, absolutely. I am unlike Elizabeth in that I have not had great experiences with healthcare. I feel like every neurologist I've ever had has just dismissed what I have to say and said, okay, this is what we're doing, that's it. And if I have a different opinion or want to try something else, they don't hear it. It just falls on deaf ears. But this new healthcare provider I established care with today, she is exactly what I've been looking for the past 10 years. She is attacking this in a multifaceted fashion, all angles, not just one thing. That's not MS. It's so many different things there are so many things that need to be paid attention to. And so I'm so excited about this new doctor. I immediately trusted her and I felt heard, and I can't believe it's taken me this long. I've been through 5 or 6 neurologists, 4 or 5 different alternative healthcare providers. Finally, I got one.
So Jess, I'm going to go to you next in terms of the importance of establishing trust with your healthcare providers or your physician. How important is it to you? And if there's been either a challenging or positive experience that you can share so we can relate.
I mean, it's it's vitally important to have doctors where the relationship is functional and everyone is willing to show up fully in honesty and trust, and with the goal to hopefully make life a little bit better for the patient. Because without that trust, it's really it makes the reality of already navigating a chronic illness 1,000% worse. At least that's been my experience so far. I will say, I have had my not great experience, but I will say that I do feel safe with my current DO. Outside of he has a nice personality, but also like I feel pretty seen and heard. Even things that I don't really directly think about, like in our last appointment, he was going through the standard tests, very much like literally like poking and prodding and all of that stuff. And I was uncomfortable, but he actually was the first to acknowledge that it is stressful. You're literally getting poked and prodded and getting asked all these questions, and MS is hard and all of these things. And just him vocalizing that I was like, oh yeah, like this is why this experience is like, it's uncomfortable, but it's, you know, I don't know, I hope that example makes sense. So it's having that comfort and safety and communication is key. And I'm pretty thankful that in general, my relationship with him is one where I feel pretty safe.
And then Annie, I intentionally left you to be the last person to answer this just because of the fact that you are a physician. And so that is a different take on a physician having to trust another physician potentially. So I'm just curious about that relationship of trust with whichever physician you think of, or healthcare provider, and perhaps a challenging or a great experience.
Yeah, I mean, it's so complicated sitting on both sides. I will say that, you know, from the patient point of view, I've had a lot of negative experiences, and I am in a good place now. I finally feel like I've landed with a good neurologist, but I have been through, like Kyle, like 4 or 5, and not because I'm like a doctor shopper, but because I just haven't found one that I felt really saw me and heard me. And I think because maybe it's particular to neurology, but most of the people I've ended up with have been probably a little bit more bench research and some clinical, but a lot of research. And so I think for me, the distinction that's important is, you know, what's right in the research sense might not be what's right for me as a person. And I think a lot of times the doctors that I have seen who've been researchers, they are more focused on, we know this is the most efficacious drug according to the research. This is how we can beat back the disease. This is the most effective treatment, but without really taking into account sort of where I am, who I am, what I want, side effects, what are my limits of what I will tolerate in terms of a drug that makes me feel crappy if I don't feel that, you know, so that whole picture has really been missing a lot, but I feel like I'm finally in a good place with that. But I've had to be choosy. But, you know, even from my first moment of diagnosis, which I've written about a lot, but which was bad, which was just sort of, you know, waiting for an hour and a half and then seeing someone for like 10 minutes and being told like, you have MS, even though I had 1 lesion on my cord and you need to take medicine right now. And I wasn't ready for that. And I just didn't feel like I was seen in that situation. So complicated. I feel like it's helped me be a better doctor. It's really changed my way that I think about how I care for my patients, in that I'm much more willing to say there's like, I may know what the research says or what I've learned, and that's my job to share that with you. But I also know that what you choose as a patient is the right way to go, and you're in charge, and there's no right answer, you know? And so I'll say that. And then the other piece that just thinking about the role of being on both sides is that sometimes I take some responsibility for my part in the relationship when I'm in the patient role, because I bring in with me maybe a knowledge of what it's like to be on the physician side. So I'm kind of guilty sometimes about like asking too many questions, or I want to be really streamlined and be like, I know you only have 15 minutes or 20 minutes. And so I'm going to like be really get to the point and not ask my questions. And so that's because I sort of know what it feels like to be on the other side, which can be very time pressured. But I also know that I'm bringing that in as a patient, and that's partly my responsibility. But it's a tough negotiation.
So what I think is interesting, a term that I know has been thrown around a lot, and mostly I know about this because of my involvement with Elizabeth, but this buzzword catchphrase of patient-centered healthcare. And I think it's an interesting term because I wonder how much of the patient input is really placed in the patient-centered healthcare when physicians are discussing this. And Elizabeth and I were speaking the other day about the importance of like finding out what the patient priority is, instead of coming in and assuming that the priority is fixing or the physical aspects. And so I'm just curious that I know hopefully several physicians and healthcare providers will be watching this. So I'm curious about what you all think patient-centered healthcare is and what physicians can bring to you all and other people who are living with multiple sclerosis when they visit their physician, whether it be neurologist or urologist or whatever. And anybody can jump in.
Like I was saying, I don't think patient-centered healthcare exists in my world until today. The doctor I found today, after 10 years, centered me as a patient and listened to my concerns. But any other doctor, they just dismiss what I have to say largely.
Say like as a well, again, I'm trying to play both roles here, but I'll say like as a doctor, like we are sort of trained in this almost like script. It's be very narrowing. It is. And it's like,
that's what it feels like.
Yeah. And it is time constrained. And the goal that you're taught is sort of to get to the diagnosis. So you're sort of charged with being a detective. And it's very like funneling and narrowing. And I think it's really important to find a doctor that doesn't go there, that changes up that script. But I also like have sympathy for the way the system is. And if people go off script, I know I've had the feeling, and I hate to say this, but as a doctor, when you're like, you have 15 minutes and you're like, have another patient waiting and someone's like, you're feeling like, oh my gosh, this is an inconvenience because you're supposed to be staying on track, which is terrible. And I think that's a systems issue, and that's so problematic. So I think we need to all find physicians that are willing to sort of go off script and not feel like there's like a solution in that visit. Like maybe you're just going to talk and then you can have another visit, and that just to make more time and space around it and to get to what matters to us as the patient and what our priorities are and what our values are. But I think that's hard in that the system has really trained physicians to not be thinking that way.
Yeah. You can go ahead, Elizabeth.
The only thing I want to say, I am so disabled that physicians don't look forward to seeing me with visits. Not that they're mean or rude, just I'm a lot to handle. I'm a quadriplegic, and it's hard to manage quadriplegia. And so I'm very aware of their time constraints, justifiable time constraints. But on the other hand, I wish I had a little more loving care with my internist or people who are dealing with bladder infections or things that are fairly normal. But I think compared to the rest of you, I'm the least wanted patient. I'm such a mess.
I wish you could see this doctor that I saw today, because I always feel with my neurologists, usually I feel that time restraint. I feel like it's all rushed. But today I was in this appointment with this lady for almost 2 hours, just talking to her.
Wow.
It was amazing. And she was like, all right, do you have anything else? I feel like I spilled my guts. I told her everything that I have tried, that I want to try. And she was on board with what I wanted to do.
That's great.
It was amazing.
Yeah, for me, at this point in my life, in and outside of my diagnosis, of course, there's been so much like contention in terms of the system and doctors and all of that. At this point, I've really realized, specifically in the conversation about, how things should be patient-centered, right? For me, so I can like experience joy in my life. I really like stepped into putting that in my hands. You know, like, and that's not just to disregard what my doctors say at all. It's not about that. It's really about Jessica, like self-talk. Jessica, what do you want to do? Like, what works for you? You know, not ignoring the reality of my diagnosis, doing the hard thing, looking in the mirror and saying, damn, you have MS. That's a humongous bummer. And also, what do you need to do? What
You gotta
do you
be
need?
your own advocate.
Very much so. And very much in an action sense.
Mhm.
You have MS. You need to, what things can you do to hopefully keep your immune system strong? You know, like, what do you, I just have to make sure I focus. I put into action the patient-centered thing because I've spent years really focusing on what the doctors think and what they want and what they say. Should I do this and should I do that? And what do they think? And it's just ultimately, like, I just gave myself a headache. It's ultimately, it's not the most productive thing, you know, so that's how I'm navigating that. Yes.
I have a question for you, Jessica and Kyle. How the hell do you know what you want? There are lots of options. I don't know if they're good or not options, but there are drugs you can take. And it's just so hard to know what you want.
It is. I want to remyelinate what has been damaged and lost. I want to restore all of this damage.
Yeah. Yeah, me too. You know, and that's not to like wag my finger at medicine in any way at all. Like, not at all. But I definitely agree with Kyle, like, very much like, you know what? Here I am, 34, I have this thing in my body. What patterns do I need to set into my regular routine that are healthy options? These nutrients, that nutrient, those nutrients, so on and so forth. I'm proud of myself. I finished this is all empty. I feel like a rock. I feel like I'm changing the whole world. So I don't know. Again, I am in no way wagging my finger at medications, and also really just focusing on how can I hopefully keep my body stronger and make it stronger. So that's me.
Kyle, what do you feel about the big MS drugs? Like,
You know, I have not wanted, that has not been my desired path. I see you, Jessica, doing the walls protocol and stuff, and I've been doing that for years, or trying my hardest to stay on that.
Hard.
But with my crazy progression and feeling like this is a runaway train, I want to do anything that could possibly slow down or stop this. So currently I am doing a disease modifying therapy, and I'm trying to figure out if I can do both. Can I do the disease modifying therapy and like the diet and the everything, or are they conflicting? It's so hard to know what to do.
Yeah.
you feel comfortable asking your physician, what do you think? Give me some advice.
Not my neurologist, because they're only the disease modifying therapies. That is her one and only thing. I've brought her so much stuff, like peer-reviewed research, not some like random Google search like, oh, look what I found. No, it's peer-reviewed medical journals that I bring to them, and it's like they don't even glance at it.
Yeah.
Don't
Legally
even
they
consider
can't though,
it.
right?
What's
Legally they can't. I mean, please correct me, Annie. Legally, you guys can't say, yes, these food types will in fact, like, legally you guys can't say something about that or
I
something?
mean, I think we can say that if we have research that supports that. What I
Okay.
will say is physicians are, at least in the United States, I would like to hear from Moyez if it's different in Australia, are very
Yes,
poorly trained in nutrition and are not at
Absolutely.
all, are not well versed at all in complementary therapies.
Exactly.
And so what they know is the medications,
Mhm.
and that is kind of it. And I have never, ever had a neurologist who's talked to me about lifestyle modifications, ever.
Yeah,
So,
no.
No. And so, you know, and with the disease, for me, like I have been on a lot of the different disease modifying therapies,
Mhm.
and I've had to push back on my physicians a few times when I've been switched to one because one wasn't working, that gave me a lot of side effects. And for me to say like, no, I'm not going to take that was really
Yeah,
hard. Was really hard. And I almost felt like I was like a bad student who was getting an F.
Yeah.
But it's scary.
It
It
is
is scary.
Yeah, it's very scary.
When a
But you
potential
want-
side effect is progressive multifocal leukoencephalopathy, which is a fast-acting fetal brain infection.
Absolutely, yes.
Is
Yeah.
that not a concern?
what is that? That's God.
Yes. 100%. And so again, that's where I come down to, like, they're thinking, well, I shouldn't lump all of them into one, but my experience has been my physicians are thinking about the research and like the data
Right.
shows X, and they're not thinking about like on the individual level, like it could cause PML in me, and I don't want to die. And I also don't want to feel like I have the flu 3 days a week, every week, you know, if I otherwise feel pretty good. And I've been lucky that I have often felt pretty good. So why would I want to take a medicine that makes me feel really crappy? But again, our goals are different. Their
Yeah.
goals are beat it back at all costs. And I'm thinking, well, I just want to live my life
Yeah.
the best I can.
And then it's like, you know, I'm assuming all four of us have full lives. If, you know, beating it back is the goal, and within beating it back, you're super sick, and you have a full-time job, and you have other responsibilities, and you have that responsibility too. It's like, no, I can't be at home sick. I have like bills. I have a 40-hour-a-week situation, if not longer. Like I can't. This is not conducive.
Mm-mm.
When I'm sick, I'm not eating well. I'm not getting the nutrients because my body feel, you know what I mean?
Mhm.
I don't know. I don't know if that completely goes off topic. It's just, you know, it's hard. Sorry, that was emotional of me.
Being a patient is hard.
Yeah.
Patient is really hard.
Um,
It really is. It's a lot. All of it is a lot. So, I don't know.
So I have a question for you. I'm going to bring Moyez in here in just a moment, but I'm listening to you all and I'm just curious. Think about all your experiences and think about the people who will be watching it, which hopefully will be physicians and healthcare providers. What is the most frustrating thing? I know there's lots. There's lots of great things too, but I know there's lots of frustrating things. If you wanted a physician to hear the most frustrating thing about a visit with you, what would it be? And anybody can jump in. And I'm going to bring in Dr. Jiwa very shortly here.
I think just being dismissed is the most frustrating thing.
Yeah, I would agree.
Yeah.
What
Yeah.
does that mean? What does dismissed mean?
I'll say
Like
like,
when I say I brought you this research that you talk about all the time, research, and you just toss it aside. Don't even consider it.
Yeah.
yeah.
Yeah, in the past I have, and honestly, I don't even like, I like woo-saw it away because it's just stressful. It's frustrating when you're talked down to about
Mhm.
things,
Mhm.
you know, and fine, maybe they're stressed, sure, but
Me
I'm
too.
not a punching bag.
Yeah.
Just because I may not high five what you say, I'm not a punching bag.
Yeah.
But that hasn't happened in years, and again I try to just push it away because it's just a really frustrating, uncomfortable scenario for the patient who's already in a neurologist's office and young adult and MS on other things, it's just like piling on. So that's my answer to the question.
My
I-
answer is my
Yeah.
physician doesn't tend to respond to the fact that I say the one thing I care about is my voice. 'Cause I'm losing my ability to talk, I think. And he says, no, you're not. Your voice is fine. When I know can't talk on the phone, there's so many episodes I could quote to tell him how many days a month can you talk on the phone. But every time he says, oh, your voice is fine, I keep checking every time you're there with me and you're fine.
Mm,
I go, no, that's not fine.
no.
I'm
That
telling
pisses
you
me
it's
off.
not fine.
Well, it pisses me off that they're dismissing your concerns here.
Yeah, it makes me think
fun.
like they can't fix it. And I think
Right.
a lot of times
Yeah.
physicians are like not used to being like sitting with,
Right.
I know that's really hard. I can't fix that. They're so trained to be like, our job is to fix that. And
Right.
so I think a lot of physicians are very uncomfortable saying like, I don't know, or yeah, I see that's really hard and we don't have a solution for that. And
They need
that is
some
what we
empathy.
want sometimes. Just that's it. You don't have to fix it, but just acknowledge this is really hard.
I know I'm really smart. You can't fix it. There's nothing you can do. I've run out of all the medications, been a
Yeah.
failure in all the medications. So there's nothing he's going to do, but it's not acknowledging
I hear
that
you.
I'm
I
in
agree.
pain.
Yeah, it's horrible. I totally agree. I'm just saying, like, I think that it's a downfall of the system and the training of doctors,
Sure.
that they're trained to think they have to fix it. And then when they can't, it's more of a personal discomfort that we have to learn as physicians to say, we don't have all the answers and we
Right.
can be with people in that suffering and don't have to make it go away, but can be present for it.
And I'm delighted the physician says, there ain't nothing you can do, I can do. You have MS. So, but just, we'll have to stick it out together or
Absolutely.
whatever. I don't care, but I'm comfortable with no answers.
Yeah, absolutely. And I think physicians need to know that we're okay with, you don't have to have the answer to fix it, but just be with us in the journey.
Yeah.
The thing that really like hit me the hardest, Elizabeth, of what you said earlier was like that you feel like a burden because you're quadriplegic and you are a lot to handle in the office. And like, I have seen that in practice. It's because the system's not set up. The tables don't move up and down. There's
Right,
no
right.
chair. There's not enough time. How are we possibly going to do this? And that's a systems breakdown. That's horrible.
Right.
And you should not have to feel that way. And I'm sorry.
I'm sorry too.
And on that note, this is why this discussion, why I'm so excited that Dr. Moyez Jiwa is here. So I know you've been taking plenty of notes, Moyez, so by all means, come on in and ask our panelists whatever you want to ask.
Sure. Thank you so much. You've said it all, in fact, and I just want to kind of summarize it and put some reflections back to you. What you're saying is you want technical answers to your problems, quite understandably. You're talking about you want to remyelinate, et cetera, but you're also talking about people not communicating, not actually giving you the space to say what it is that's so frustrating in your lives. I would say that certainly we are not trained in dietetics. On our course, for example, on our undergraduate course, we have virtually no dietetic teaching at all. So our doctors go out there not trained to be proficient in that. That's one thing. The second thing they're not trained in, and this may come as a shock to you, is that they're not trained to understand research. Not really to understand the business of randomized controlled trials and how you assess them, etc., you might assume they do. And I'm talking here particularly about family medicine, which is quite a different, kind of perspective. So I want to go back to you and say, you got 15 minutes to have this conversation with a doctor and you want to establish trust. How can we do that in the 15 minutes, knowing that in fact the real expert is sitting on the other side of the desk, not the doctor? You're the real experts. So how do we establish trust in that context? Any of you?
Give us more than 15 minutes to plead our case. Like me in particular, I know I can get tongue-tied and flustered, and there's cognitive issues with MS. And sometimes I go in there, and unless I've got like a big old set of notes, I might not get what I'm trying to say across to my doctor and not get my message across. So it's about the time, it seems.
Can you pose the question one more time, please? Like, what was the exact question?
So the exact question is, we've got 15 minutes on average, and
Right.
that's very sad that we have 15 minutes, but how in that 15 minutes can we break down these barriers so that you feel that you've been seen and you've been heard?
Maybe, I don't know. I mean, maybe I'm thinking just specifically about me and how I want to approach it so I can like break free and, and drop my shoulders hopefully a little bit, right? Putting a lot of that trust in myself, and that's not taking away from the doctor at all. Again, it's not saying they don't know what they're talking about. I'm not saying they're not professional. It's not that.
Yeah.
But it's like, I know I have an appointment. So really just trying to center myself, and however that may look, knowing that's only 15 minutes, which is very short, knowing that it's about a very large thing that is my diagnosis, and I may have 1,000 questions, right? I don't know. And knowing that I won't get the time, and what am I going to do about that? So I don't know if that sounds too broad. And I'm not like minimizing the unfortunate systemic realities of the whole thing. And it's like, I'm not accepting it, but maybe it's just a thing of like, unfortunately, this is what it is. I only have this amount of time for this size thing. And I don't know. Does my answer suck? I don't know. It's hard.
I think the saddest thing about that answer is that you said you won't need to be centered. We need to be told the truth, and we need to be told it without any kind of, sugarcoating. You need to tell us, guys, you need to center yourselves. You need to be present, right? How long is it before you turn to your computer and start fiddling on that and writing notes? How long is it before your shoulders are pointed away and your knees are pointed over there? How long is it before you lose interest because the patient's quadriplegic and you just don't know where to start?
Yeah.
So I put that back to you. How can we establish trust with you? You're doing your bit. What do we need to do?
See us as people, not patients. Not saying you don't necessarily do that, but if that makes sense. Like, we're whole people. You know what I mean? Yes, I had MS, but also after a quadrillion years, I'll finally most likely be in a PhD program. I'm actually like pretty stable in my life. I've learned a lot, not just academically. I'm thinking specifically in terms of like health stuff. Like, this is where I am. I'm a whole person, if that makes sense. So sorry, my brain just went blank. Sorry.
Oh, that was awesome.
That was brilliant.
So,
Brilliant.
we're all human beings. We're layered people like everybody else. So
we just need some empathy, apparently.
give us a hug.
Yeah, yeah.
It's more than that, though, isn't it, Kyle? It's more than just empathy. You want to be seen, you want to be heard, and
For
you
sure.
want your perspective taken into account. Because at the end of the day, you guys have said things that kind of, I thought, oh, well, what's that condition you're talking about? That encephalitis? What? You know, you're the expert. You've been there. So how do we respond to you in a way that isn't just being fatuous and giving you a hug? It's saying, I see you and I want to work with you. So let's do this together. How do we do that?
If I or another patient brings something that the doctor is unfamiliar with, like today I was talking to my doctor about fecal transplants, and they're like, we don't really, we've seen stuff with that, but I'll do some homework and I'll get back to you.
Yep.
So yeah, I've heard that before, like, oh, let me look into that. And 99% of the time I never hear anything back.
Yeah.
So maybe just asking the doctors to do a little homework if I ask them to.
Yeah. I mean, remembering that we're like a team, because I do think that, yeah, like we're living with the thing, you know, we are experts, but also so are you.
Yeah.
And that doesn't, like, we're a team. Both of you do know, like, you guys are not, like, you guys know shit. Like, it's not like, but we can bring all that knowledge together, and again, hopefully make things better for the people living with the illness. So
I think that's beautifully said, Jessica. I agree. I guess what comes to my mind is like trying to put on my patient hat is I wish it wasn't so goal oriented always, the visits. Like even if you have 15 minutes, I wish it wasn't always like, you know, we're trying to get to, you know, from here to there, and like it's very focused, and instead of like an open space to just be like what's on your mind today and where are you, like there's more. I wish there was more like a being with each other in the room and seeing where it goes in an open, attuned way, rather than we have an agenda.
Yeah, that was my experience today.
Yeah.
It was so great.
that's fantastic. I'm glad you had that, Kyle. I really am.
Oh my gosh.
Yeah.
It's been 10 years. Oh, it's about time.
Yeah.
Good timing that it was today.
Yeah, right?
Good time. I want to ask another question. I wanted to ask you, Kyle, and also Elizabeth, this question. So you've both found doctors that you're comfortable with and who you think this is my go-to person when I'm not feeling right. What happens if that person isn't available for whatever reason? It happens to be a holiday or a weekend or sometime when they can't be there, you know, 365, etc. How do you feel about that? How will you square that circle?
For me personally, I don't expect my doctor to be around 365. I expect them to be dealing with this with me, just long term, the big picture. I'm not expecting, like, if I have some crazy flare up or something, I'm not going to be like texting my doctor, hey, what do I do? Oh my gosh. And expecting them to get back to me right then and there. For me, I guess it's just more big picture, that relationship. Yeah.
Great. Elizabeth.
Kyle, I feel the same way. I see my neurologist as a big picture person.
So how do we make you feel safe? How do we make you feel that you are in a place where you know they've got it, they've got this? I think somebody was talking about an experience there where they said that they felt that, it was you, Elizabeth, that said, you know, it's COVID times, I'm feeling breathless, and the doctor said, I've got this. How can we replicate that? How do we capture that experience and make it generalized?
I don't think you can with 15 minutes. Just don't think you can with a disease like MS, which is so complicated. involves every organ potentially. I just don't see how it could be done.
Mm.
And if you're quadriplegia, you're dealing with, even more issues that the poor physician has to deal with, the poor patient has to deal with. So it just takes more than 15 minutes.
It does. I'd say though, like for me, like I don't want my doctor, I don't expect them to have all the answers, but what I really want is to think that someone like is thinking about me when they're not in the exam room. And I don't mean that in like a egotistical way, but I know that I do bring patients home when I'm on the doctor's side that I'm thinking about and that I'm worried about, and like as a patient, I want to know that not that they're thinking about me 24/7, but that they care about me in a bigger sense, and that I don't just go out of their head when we're not in the exam room. And they don't have to have all the answers, but just so that they're thinking always, not always, but they're thinking what, maybe something pops into their head. Like, I don't know, just that we don't just disappear, out of their heads.
I agree.
Yeah.
So here's another question. What is it, and I'm asking all of you the same question, what is it that your doctor doesn't know about you, but you wish they did?
Is how important working is to me. It gives me so much joy and a sense of purpose. And I feel like that's really critical to my life. And I'm not sure any of my physicians get that. But I just don't know that. Certainly express that in many, many visits. But I don't know. I don't know if there's anything they can do about it.
Why don't they know? Why doesn't that penny drop? Here's somebody who really finds their creativity is helping them through this. Why don't they know that?
I don't know.
Maybe it goes into the whole being dismissed. Like, I feel like I've brought up some things sometimes and they're just like, okay, that's great. Like, not even considering what it could be doing to benefit me. So yeah, I feel like that rolls into the just being dismissed.
Right.
I think for me, you said you posed the question, what do they not know about you that you want them to know? That I'm a go-getter.
Me too.
Like,
me too.
just like, and I'm not pumping my chest out at all. It's not that, but it's like
You can. You can.
Do it.
You guys are so sweet. I love you guys so much. But who knows? Was there moments when I quote unquote should have stopped? Like, I transferred schools to step into my bachelor's degree 2 months after I was like freshly newly diagnosed, and that was, I graduated, but that was crazy. But I mean, it's like I just want them to know that I have so many, like Elizabeth, I like to work. Like, I have all these things that I do and that I love, and I want to go here and I want to experience that. And I want to continue to reach and love and explore and learn and continue to do all these dynamic things that hopefully positively affect at least one person. Like, I want to do those things. I want to bask in all of the glory that life has to bring despite this crazy illness. And yeah, so, yeah.
Or because of your illness.
Say that one more time, Elizabeth.
Part of it is because of your illness.
Yeah. I remember years ago that grant project you told me about, and I said that urgency, like it's like skyrocketed. Like like it's already in me. I already have my passions, desires, like that's not like a new thing per se, but post-diagnosis, it's just like exploded. Like I have to reach as far as I can and keep trying, you know what I mean? So
For you.
yeah.
That's my desire for this program, is to help people gain ownership of their disease. It's up to us to establish a relationship with multiple sclerosis.
Mhm.
And Kyle, it can be your response, which is fuck this MS.
Okay.
That's a appropriate response. But I mean, it's something that you feel power to own. Your anger or your happiness, whatever, ownership, so important.
Mhm.
For me anyway. That's what I think. That's why I can say I really feel MS is my friend,
Mhm.
and I don't expect anyone else would mirror that. But
Trying to.
It's
Trying
true.
so hard.
I feel like this being part of this program has helped me, as I've said before, to
Me too.
step into that, into my diagnosis and to try to make friends with it. Whereas like, even though I've sort of been talking about it for a lot of years, I haven't ever really fully embraced it. I'm working on it. The question that you asked, Moyez, about what would I want my doctors to know, what popped into my head is just, I think I want them to know that I'm afraid sometimes. And I come off sometimes with a persona of, I got it, I'm good.
Yeah.
Good. I'm not worried. And it's hard to get me to say I'm afraid, but I am.
Yeah. There's an interesting question someone's asked, and I think it's Kimberly's asked this question. Do you want your physician to act like a mentor, a collaborator, or a friend, or all of the above?
From my perspective, I think about my death. I'm not being morbid, but I think it would be a little mentor, a little friend, a little of everything. Someone who I could care about, and someone that would care about me.
Yes. Agree.
Yeah, I agree too. I think I would think of it more as a collaborator.
Yeah, me too. And that's what I felt like today. Like, this lady is my collaborator, and oh my gosh, I'm so excited.
Yeah, like when I've collaborated with other artists, they usually are also, there is like a friendship and a care there as we create this beautiful thing.
For sure.
Right. So I would say that maybe all of those individual relationship types, I guess, kind of intermingle. But to me, collaborator sounds actually kind of magical.
Yeah.
Like really magical. It makes me like want to cry, like really magical. So.
And Moyez, do you think physicians can become a combination, mentor, friend, etc.? Annie?
Or is that asking too much?
Let's let Moyez answer first. I have thoughts. I want to hear yours though, Moyez.
I think that's why we become doctors, and particularly in family medicine, that's why we become doctors. We want to be all of those things. We want to be a mentor. We want to be a collaborator. And by jingo, we want to be your friend as well. The most refreshing thing you could do, I suspect, is to go into a doctor's clinic and say, can you put the notes aside first? Let me tell you about myself. I'm a go-getter, okay? That's what matters to me. And from now on, from this point on, our relationship is going to be about how you're going to make me a go-getter. You're part of the team. You're the cheerleader. You're whatever else. This is the way we're going. Let's start our relationship on that footing. It might change the whole dynamic, 15 minutes or no. Annie, what do you think?
I think that's absolutely right. I like that, the frame shift. I would love that. But I do think, I think that's a lot to, I mean, I want that of my patients. I want them to feel comfortable, but I think it's also hard to be on the patient side and to feel comfortable coming in and leading with that. So I think we as physicians have to make space for that, to not try and like start directing traffic, you know, immediately and let it unfold. Because I think it would be so wonderful if we could have more of that. But I don't think patients often feel empowered to step in and say, I'm a go-getter and this is what I want. But I think that's how it should be. I also like, I agree with you. I think we all go into it because we want to be that combination of collaborator, friend, and what was the other thing? I don't know.
Mentor.
Yeah, all of it. But I think that we're trained sort of not to be a friend. Like there's a fear instilled in us as doctors not to cross that boundary and be too much of a friend, which bothers me. Like I kind of like it when my physician can, it's okay if they're a little bit of a friend. But I think there is sort of in the training built in, like boundaries, don't get too emotionally involved, which of course boundaries are important, but I think it goes a bit too far sometimes. And I think providers need to have enough trust in themselves to know that they can be a friend and still think they're going to make sound decisions.
I think that boundaries are so wild. Like when you said that, I'm thinking about, you know, teaching positions I've had and how it's like these power dynamics. But then like to bring it back to this conversation of someone living with a whole chronic illness, that's wildly intimate. Like,
Yes.
and then to say no, or at least to be, you know, to be trained in a certain way and to be like, no, boundaries, I'm not your friend, even though we're talking about you living with, again, like a chronic illness, which is
wildly intimate. I love that. Wildly intimate. It is.
Wild.
Yes.
Oh my gosh.
And I get it. Like it's, you know, wrapped up in systemic stuff. Fine. Like I understand that, but it's just like, this is really intimate. This is like my life. This is my body. This is my mind. We're talking about like independence and whatever that even means. It just, I don't know. I don't want to go off topic. it's just wild.
Not often.
One thing I'd like to mention, and we're running out of time. I do a lot of role playing when I go see my neurologist. I feel like I'm not totally honest. I feel I have an image to protect.
Yeah.
And I suspect he feels the same way. I don't know that, but I would like to break down, to be more vulnerable. It's scary to be vulnerable.
I've heard this in previous conversations with, I think, almost all four of you, where you've talked about being doctor pleasers. And my plea to you is to stop. Please stop. Don't be a doctor pleaser. Please
I don't think I'm a doctor pleaser.
Yay, Kyle.
I would say I have been.
I think I'm a pain in the ass for my doctors.
I am.
I'm a 100% doctor pleaser.
It's really hard to stop. It's really hard to stop that like thought process and behavior. Even if you know it's like not productive, it's hard to stop, but I will work on stopping.
I agree.
We're only human at the end of the day. And to be honest with you, you're the expert. We'll admit that readily if we're honest with ourselves. put the white coat away for 5 minutes and just look at the person sitting in front of you. Put yourself in their shoes. We want to do that because we want to be part of your life. You are, it's like watching a butterfly caught in your hand, and you can see all this flapping going on, and you're almost afraid to open your hand and let it out. We want to do that. We want to let it out and watch you fly and soar, which you're doing. Jessica, you're soaring. I mean, you know it, we can see it. You just got to let us see it so that we can be part of this wonderful journey that you're on.
Thank you.
I think you're special though, Moyez. I mean, I think there are, I do. There are, I think many physicians go into training and medicine wanting that, but I think it gets beaten out of a lot of people. And I think we need to rejuvenate that in physicians, because I believe you when you say you want the butterfly to come out, but I don't believe that with all my doctors.
Yeah.
Sadly.
Well, the loss is ours if we don't allow it to happen. I don't think I'm in any way special. I think there are people there who want the permission to do what you're asking us to do. And you've got the very condition that puts us in a position where it knocks all the nonsense out of the system. It basically says, you know nothing really, because the person sitting in front of you has got the papers that essentially tell you everything. So why don't you just chill out and enjoy the ride?
Can you do it under
Like this
15
guy.
minutes?
It's just, I know we're like out of time, just out of like curiosity. So I've never been to Australia. Systemically, as doctors, it all functions the same as in the US, right? Okay. Okay.
I was wondering
Don't
how
laugh at
similar it was. I
Oh,
mean,
it's a good question.
So I don't know if
Yeah.
there's some other uptick of something that the doctors there do or don't do. I was just curious.
No, it's not different. I've worked in the UK, I've worked in Australia, I've worked in Ireland. So, I don't see any different. When Annie and I are talking, it's like we know what we're talking about. This kind of feels very familiar, the way that we work. And we just need to find the way to reconnect with people. The pandemic has taught us that. If we don't do that, we're the ones that are losing out. My plea to you is for doctors, not because we think we know better, but because we need you. We need you to bring back the caring that we feel deep inside.
Well said.
I like this guy. Be here. I like and Annie. We love both of the doctors. We love both. We love both.
Well, as per usual, we've used up the whole hour plus a little. But this has been really great. Dr. Jiwa, thank you so much for joining us. This has been really special, I think. And so I also want to say thank you to everybody who's watching, and we'll see you next month. And I do want to say that somebody that you don't always see, which is Kimberly Warner with Unfixed Media, she will be taking my spot next month because I will not be available. I will be working in Hawaii, yay me. But we invite you all to view any of our previous episodes. They're available on YouTube, and you can access them on Unfixed Media's website at unfixedmedia.com, or even on Elizabeth Jameson's website at jamesonfineart.com. So that's it for now. Thanks, everybody. Again, this was a great conversation and really wonderful to have a dialogue between physician and patient. So.
Thank you, everyone.
Thank you.
Moyez, I think your practice grew by 4 tonight, at least 4.
Bye.
All right. Good night, everybody.
Good night.
Good night, everybody.